Hello, everyone, and welcome back to my YouTube channel. I hope you all are having a wonderful day, whatever day or season it is that you are listening to this. And today I've got something kind of special for you. Um, those of you who know me know that I have a bit of an extensive background in what we call gastrointestinal or GI disorders. And there is just so much media attention right now focusing on things like gut health and gut nutrition and your microbiome and kind of all of these buzzwords. So I want to kind of take some time to break down, first of all, what all of those mean, and then also some ways that you can kind of optimize your gut health or your GI health. Um, as always, if you have questions, you are more than welcome to contact me. And I would like to also place the disclaimer that I am not a medical doctor. I'm not able to um, diagnose gastrointestinal disorders, but I am very familiar with the treatment of them, at least in the context of nutrition and supplements. When it comes to medication, as always, that should be discussed with a medical provider. And if anything we are discussing today leads you to think like, do I need to be are there things that I need to do to change my eating plan or my gut health? Always consult a doctor or a healthcare professional before making those changes, right? So definitely kind of, all of this is going to be kind of surface level, very kind of high view, but of course, everybody's body is different. So please, make sure that you are getting the advice from the professionals that you need to make the changes that may or may not be appropriate for you. Um, so with that, we'll kind of launch right in. Kind of the biggest buzzword that I hear, in media and things like that is what we call gut health. And really what we're referring to when we say gut health, a lot of times it can be kind of one of two things. One is just the health of your general GI tract or your gastrointestinal tract. And I'll talk about what that looks like in a minute. And then the other big thing that it can be is specifically a part of your GI tract called your colon. So kind of just to give you kind of a rundown of how your GI tract, like what it consists of and how it works. You have, the very first part of your GI tract is actually your mouth. You have salivary glands in there that actually, obviously your teeth and jaw are there to chew and break up your food, but you also release enzymes in your saliva as well to start breaking down some of those nutritional components. Then of course you swallow your food. That it then goes through a tube in your chest called your esophagus, and it kind of is just then cranked down into your stomach. That process tends to happen very quickly, but of course with every every step along the way, there's a possibility for things to go wrong. So there certainly are things in your esophagus that can go wrong. There's things in your mouth that can go wrong too. And then of course, once your food gets into your stomach, it's in this kind of big bowl where your stomach is releasing enzymes and acid to further break down your food, but it's also mechanically churning. So you've kind of got these multiple directions of muscle movement, and that is kind of breaking your food down, even, kind of just putting it in a big blender, right? Where it's breaking your food down into smaller components. From there, the food leaves your stomach and it goes into what's called your small intestine or your small bowel. That is where most of what we call the absorption happens. So real quick rundown of like terms I'm going to use. Digestion is the breakdown of food. So that is breaking down your food into small enough molecules that your body can absorb it. So for example, if you eat a potato chip, right? That potato chip is largely starch and it's got a little bit of fat probably with it too. So your body can only break those starches down when they are individual molecules. So normally the starch is just kind of like this chain of sugar molecules stuck together, but your body can't absorb the whole chain at once. It has to break it down, which is where those enzymes that I mentioned a minute ago come into play. So you have some enzyme activity in your mouth, you have some in your stomach, and then a lot of the enzyme activity actually happens once your food gets to that small bowel. So a lot of the breakdown that happens from your mouth into your stomach is mechanical breakdown. So it's like physically like kind of jostling up your food to make it kind of a pulp, so to speak. Then once your food goes from your stomach to your small intestine, that's where the heavy hitter enzymes from your pancreas. So your pancreas is not part of your gastrointestinal tract, in the sense that it's not part of kind of this big long tube from mouth to anus that we kind of think about as being like the GI tract. That said, it's a very key player in your digestive health. It's what we call an ancillary organ, or it is basically adjacent to your GI tract, but it has a really heavy function in it. Other organs that serve in similar roles are things like your liver and your gallbladder, which I'll get to in just a minute. But I say all that to say is that even though your pancreas is not actively part of your digestive tract, it's still like where we have problems with GI function. A lot of times the pancreas is the target, and that's because its job is to secrete these enzymes. Those enzymes then enter your small intestine, where all of your food is kind of trickling in from your stomach, and those enzymes are kind of finish the job, right? So they finish breaking down these foods into individual molecules, and then it's actually absorbed through your intestinal wall into your bloodstream. So that's how your body actually makes use of the food that you eat, right? So when we say, we're eating things that have like, carbs and fat and calories and stuff like that, all of that comes from your body's ability to take that food, mechanically break it down, and then enzymatically separate it and absorb it into your bloodstream. Everything that is not digested kind of continues on through your small bowel into your large bowel or your colon or your large intestine. All three terms mean the same thing. And this is where we used to think, okay, well, your colon just kind of creates waste. There's some kind of like ion or electrolyte reabsorption, potassium absorption happens in the colon. But for the most part, we're kind of just collecting waste. And that's what we honestly thought for decades was like all the colon did. It's just like, oh, it's just a storage place for all of our waste. And we could not have been more wrong. So what we have learned is that you actually have a very, very diverse population of bacteria in your colon. So that is kind of what we think of when we talk about, if you've heard people talk about like your gut microbiome, or even like gut health, a lot of times we're referring to specifically the bacterial health in your colon. And what we've learned is that, I could go on for days about this, but we've learned that the health of your colon, and specifically the health of the bacterial cultures there, the ratios of different strains of bacteria, all of those things are one, very unique person to person, but they also drive a lot of other factors of our health. So things like our stress level, our mood, our sleep cycles, our weight, things like diabetes and cardiometabolic factors. So like, cardiovascular disease and things like that have all been tied back to the health of the gut microbiome. Now, I want to pause here and be explicitly clear that what we know at this point anyway is that for most of those things that I just mentioned, so like mood, stress, sleep, weight, and particularly diabetes, cardiovascular is a little on the fence. We know that there's an association, right? So we know that if you have a healthy gut microbiome, you're less at risk for those diseases. What we don't know is the direction. Okay, so I want to be really, really clear about that. We know that there's an association between a healthy gut and lack of disease state. What we don't know is whether the disease causes the disruption to the microbiome, or if the disruption to the microbiome causes the disease. We don't know that yet. All we know is that they are associated with each other. And I think that's really, really important when we're breaking down scientific data, because so often the science, like if you read the actual papers, like the studies that were actually done, they're very clear about that. They're very, very clear that like, look, there's just an association. BMI is another perfect example. All we know about BMI is that high BMIs are associated with certain diseases. The BMI is trash. So like we all know that that's kind of irrelevant, but even if it weren't, we still don't know the direction. We don't know if the disease causes the high BMI or if the high BMI causes the disease. So the same thing applies here. And I feel like so often that's where science communication goes wrong, right? That's when like the popular media gets a hold of these things and warps it and spins it to suggest a causational relationship when in fact we do not have one. So I want to be very, very clear that like we know that your gut health is very much associated with your risk for other disease states. We just don't know which way it's going. Um, that said, all we can do to foster a healthy gut, great, the better. And then, of course, as I mentioned, and we will get much more into, is that every step along the way, right? So every point of your GI tract, your mouth, your esophagus, your stomach, your small intestine, and your large intestine all present opportunities for things to go wrong, right? This is a hugely dynamic and very, very complicated system, right? We really don't give it enough credit for working as well as it does most days. So, when we're thinking about things that can go wrong in the GI tract, that's what, we kind of think, okay, based on your symptoms, where might the problem be? And that's where seeing a GI doctor who either has knowledge of diagnostic criteria, can order blood work or imaging work, such as like an ultrasound, a CT scan, or like a colonoscopy or an endoscopy to kind of get a visual on things. That's where a lot of their work comes into play. And then my job to that is to say, okay, what does that mean for you nutritionally? One, if you have a certain disease, are you at risk for missing nutrients or things like that? Or what do we need to do nutritionally so that you can manage symptoms? Depending on the disease, there are certainly medications that are used to manage a lot of gastrointestinal disorders. And I guess one thing I forgot to mention a moment ago is we've got all of our points in the actual GI tract itself, but then we also have these ancillary organs such as your liver, your pancreas, and your gallbladder that are vital in the function primarily of digesting and absorbing nutrients. So your pancreas, as I mentioned, does provide all of those enzymes. So a lot of times if people aren't able to secrete certain enzymes, they end up with GI distress. We'll talk about that in a second. Your gallbladder is another really common one. Your gallbladder holds bile, which is responsible for fat breakdown. So again, if your gallbladder isn't functioning properly, then sometimes high fat meals can cause GI distress. And we can kind of talk through a little bit more of like what the specifics of that might look like, but just keep in mind, this is a very dynamic, very complicated organ system that, works great most of the time, but when it doesn't, what do we do? So, I think it's important to think about, okay, when we think about, problems with your gut, either it's your gut microbiome or even just your GI system in general, a lot of times the indicator that there is something wrong is you are likely going to have symptoms, right? Those symptoms can kind of run the gamut depending on what's causing them. But it's going to be things like, constipation, diarrhea, alternating bouts of both gas, bloating, heartburn is a GI symptom, things like that. Now this is the fun part, right? So now we're getting into talking about poop, right? So I think it's important to kind of distinguish a little bit of like what is normal versus what is not, because I think the popular media, unfortunately, can kind of, again, because of all of those associations, the popular media says like, oh, well, like, if your gut microbiome's off, like that might be why you're gaining weight, or if your gut microbiome's off, that may be why, you're experiencing spikes in blood sugar or brain fog or like what have you. And the truth of the matter is that, again, we don't have causational reasons to kind of link those things. I think it also does kind of a poor job of explaining what is normal and what is not. And that's just because, they don't want to sit there and like print a whole article about poop, but reality is, maybe they need to. So, first things first, I want to be clear that like when you are having bowel movements, it is totally normal to not have a bowel movement every single day. That said, it is also totally normal to have a bowel movement every day, or it's also normal to have multiple bowel movements per day. I would say what we consider normal is everything from everything from once every other day to or 3 times a day. Sorry, butchered that. So what is normal is once every other day or 3 times a day. If you are having more bowel movements than that or fewer bowel movements than that, it just might be something to examine. And in terms of kind of consistency and things like that, I don't know how many of you are familiar with the Bristol stool scale, but it is just kind of a ranking of like 1 to 5. Let me see if I can get one pulled up here. Oops. There we go. Share my screen. Sorry, 1 to 7, not 1 to 5. That just kind of looks at the like size and consistency of your poop. So where we want to kind of live is really anywhere from like a 2 to a 3 to like a 5, right? And ignore this kind of severe constipation, severe diarrhea. But basically, we want anything from kind of a 2 to a 3 to a 5. That's kind of what we consider normal. If you are consistently having hard lumps or you're having to strain, that's not a good sign. But also if you are consistently having very mushy or even liquidy stools, even if the occurrence rate, so even if you're only having 1 bowel movement per day, but it's straight liquid, that's not normal. If you're having 1 bowel movement every other day, but you're really having to strain and you're getting kind of these lumps, that's also not normal. A lot of times that does just go back to, and that said, having an occasional liquid bowel movement is okay. It means that something you ate probably didn't agree with you, but consistently having this, that's definitely something you want to get checked out. Same way with this, it may be that, your diet was a little off just for a couple of days for whatever reason, and you have some kind of harder to pass stools. That is okay. But if it persists and is consistent, that's what we want to kind of think about getting checked out. Again, go into a good gastroenterologist. If you don't have a gastroenterologist, so most of us don't, getting with your primary care and talking about it and asking for a referral to a specialist if it really persists. So that's kind of what we consider normal. Also, things that people don't realize are normal that actually are things like things like gas and bloating. So gas and bloating sometimes are normal. Again, it should not be like, nothing. Gas can cause pain very often. So you don't want to be, anything that's like causing like you to be doubled over in pain or something like that. That's definitely abnormal. Go get that checked out. But a lot of times like our stomachs do expand when we eat. And a lot of times people think like, oh, I feel bloated, blah, blah, blah. And to an extent, some of that expansion is truly normal. It is normal for your stomach to stick out a little bit after you've eaten. It's quite literally a balloon inside your body that has expanded with the meal that you just ate. I feel like diet culture and things like that very often tend to kind of indicate that, well, we should have these like nice flat stomachs all the time. That's not true. Okay. Your stomach is going to expand and contract when you eat. So just because it has expanded does not mean you are bloated. True bloating, it feels very, very swollen. It's very like, you don't necessarily feel full, but it's almost like a very hard, like almost like a pregnancy belly or something. Like you can poke it and it doesn't go anywhere. Sometimes there's some pain and discomfort with that. Sometimes there's flatulence or belching. Basically bloating is just gas that is trapped in your GI system somewhere, most likely your colon. So what happens very often is as your food makes its way through your stomach and it gets absorbed into your small intestine, as I mentioned, a lot of food that's not digested makes its way to your colon. Certain things are supposed to be in your colon and certain things are not. When your colon and all those bacteria in your colon get a hold of certain like sugars and starches and things like that, if they are not digested and absorbed further up the chain in the digestive system, basically what happens is the bacteria latch onto those as a meal. And they create a lot of gas as a byproduct, which isn't necessarily harmful in a lot of times, but it can cause a lot of discomfort. So again, that super swelling, bloating, as we call it, distension, that's not normal. But having your stomach expand, even some like occasional flatulence and belching, it's normal to fart, upwards of like 20 times per day. It's not a comfortable fact that most of us think about, but that is in fact normal. And certain foods like beans, certain types of vegetables and things like that are kind of known to produce more gas. And those, the flatulence may be increased after eating those types of foods. It's not indicative of a problem unless it's happening kind of like persistently, and in a way kind of getting in the way of your life. If you ate a bean burrito and you're a little gassy afterwards, that is not an indicator of a problem. It just means that you ate beans. All right. So I think it's kind of important to kind of distinguish some of those things. But if it's kind of like seemingly every time you eat or like multiple times per week, you're having this real severe swelling and you're having like abdominal pain or cramping and things like that, then that's definitely something you want to get checked out. So those are things that are certainly not normal. So kind of, thinking about what to do and what can go wrong, I think a lot of it kind of comes down to pinpointing kind of where in your digestive tract problem may be occurring and what that might mean. Just a very brief rundown of like different digestive disorders. There's everything from like food allergies and sensitivities, pancreatic enzyme problems, gallbladder problems. I mean, there's just such a huge gamut. And again, so much of like the popular media just butchers what the actual science says on these things. One thing that I really in terms of a diagnosis that I do want to focus on is food allergies versus intolerances and how to tell the difference. So a true food allergy, it doesn't matter what it is, basically means that your body has recognized some protein in that food, whether it's milk, soy, eggs, corn, whatever. It's a protein in the food that your body is recognizing as an invader, and it is actively creating what's called an immune response. So it's pulling in your immune system to target that molecule. So every time you eat that food, you get this flare of inflammation or immune response, right? So I also want to be clear that like inflammation is an immune response. That's what it is. Like inflammation is just this term again that the popular media just like throws around. But what inflammation means is that your body's immune system is active. That's all it means. And it can be a good thing or a bad thing. So in the case of a food allergy, your immune system is being called into action based on a food that really does not pose a threat to you, but your body doesn't know that. So that's a bad case of inflammation, right? When you get sick and your body is trying to fight a virus, that's another case of inflammation. Your body is very inflamed at that point, but it's a good thing because that's exactly what your immune system is designed to do. And so I feel like so much we just kind of hear like inflammation is kind of like this catch-all phrase. It just means that your body is either attacking something to get rid of it or it's trying to heal something. So which can be good or bad just depending on the situation. So that's a food allergies, is active engagement of your immune response. The only way to tell if you truly have a food allergy is to get a test. Those tests can only be and should only be ordered by your doctors. Those are things like an IgE blood panel test. That's a blood test to test for food allergies. And most allergists also do like a skin prick test. So they would put just like kind of little dots either on your arm is really common, sometimes on your leg or your back, just depending how many you want to do. And there's a lot of science behind why like the blood tests aren't perfect. They can be kind of a good first pass, but really you should also do like a skin prick test to confirm. And they kind of basically pull the data together. That said, you can either outgrow or develop new allergies at any point in time. So if you've been told when you were a child, hey, you're allergic to eggs, and now you're 25 and you've been avoiding eggs your whole life, get retested. I always recommend that people get tested at minimum once every like 5 to 10 years just to see if their allergies have changed. Because honestly, you even if you were allergic to eggs at one point in your life, you may not be anymore. And of course, if you never were allergic to eggs, you can always develop a new allergy. There's so much that goes into like why that happens, but for now, just know that that's it. That you can develop or get rid of an allergy at any point in time. But that IgE blood test that can only be ordered by a doctor, that's super important. As well as a skin prick test. There are other things that like some kind of more like holistic and naturopathic doctors order. A95 panels and N95 panel, or I'm sorry, A95 and E95 panels are kind of like the two more common ones. Some of those are kind of like, but the majority of them, they are looking for like an IgE response. As long as there is an IgE, which is the type of antibody that mediates your immune response, then that's okay. There's other things included in like an A95 and like different types of like molds and parasites and stuff like that, that quite frankly, your body doesn't produce IgE antibodies against. But that said, that's kind of neither here nor there. Just know that that IgE panel is what you're looking for, at least in terms of food. Other allergies, it can be kind of different. So that's an allergy. An intolerance is different. So an intolerance means that you are not providing an immune response. So your body is not actively attacking whatever it is, but it is also not breaking it down well. So that's kind of where this whole idea of like things not getting digested properly, if they're not broken down into individual molecules, then your body can't absorb them. They make their way then through your small intestine. So they're supposed to get absorbed, early on in your small intestine. But if they don't, what happens is they make their way to your colon, where the bacteria in your colon then just have a heyday, because those are typically, I'm thinking of lactose in particular is a very common intolerance that people have. If your pancreas does not produce enough lactase, which is the enzyme that breaks down lactose, which is the sugar in milk, what happens is that lactose doesn't get digested. So it doesn't get broken apart into individual molecules. It doesn't get absorbed. So it doesn't get absorbed through your intestinal barrier. And then it makes its way through where it's not supposed to be in your small intestine into your large intestine. And then the bacteria there say, oh, yay, sugar. They can make use of it, but they produce a lot of gas as an offshoot, sometimes diarrhea too. So that's a slight difference. In the popular media, and I don't even know how these things are legal, to be perfectly honest with you. In the popular media, there are lots of tests and things like that to like test for like food sensitivities and stuff like that. And I hate to say it, but those are all honestly just complete garbage. The reason why they're garbage and they're a waste of your money is that you cannot test. They use antibody testing, which you can use for food allergies, but you cannot use for food sensitivity. So like I just said, your body is not creating antibodies. It is not creating an immune response. So I guess I should back up and say an immune response is tied to antibodies, right? It's tied to antibody production. That's how your body and your immune system, it flags molecules or viruses or bacteria or whatever that are invaders. It uses an antibody to put a little flag and be like, hey, this is a problem. And then your immune cells, like your B cells and your T cells, come and kill it because it's tagged by that flag. So an antibody indicates an immune response. Your body does not create an immune response for food sensitivities. So there are no antibodies when it comes to a food sensitivity. It's a totally different process. That said, these food sensitivity tests try to tell you, oh, well, we use antibody testing, blah, 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 to make it sound scientific. One, they are not using antibodies. They're not using IgE antibodies, which are the immune flags. Okay. Second, the antibodies that they are using indicate nothing. They are, in fact, the antibodies that they use are actually kind of what we call neutralizer antibodies or IgG antibodies. What those do is they flag food, kind of be like, hey, this is okay. Like, just like skip over me. This is not a red flag. And it just kind of, kind of a perpetual, just kind of like taking stock to make sure that you don't create an immune response. So it's actually kind of like an allergy prevention program, or at least that's what we think. I should say that. But basically those IgG antibodies that most food sensitivity tests, and I'm thinking about things like Everlywell, and I've seen like others with like genetic testing and like eat for your genetics, eat for your blood type, like all that stuff is bullshit. It just is. We don't have the science to accurately test for food sensitivities. and without just kind of process of elimination. And that is something where you should absolutely talk with a doctor, work with a dietitian one-on-one, because like what worked for somebody else or worked for somebody in a magazine, like there's no, like everybody's digestive system is so complicated and so intricate that what works for one person is not going to work for another. These symptoms are kind of, things like bloating, gas, diarrhea, constipation. They can be caused by any number of things. So it's not like, oh, well, if you're gluten sensitive, you have bloating. If you're, dairy sensitive, you have gas. Like that's not the case. Okay. Everybody's body is going to manifest the same intolerances even differently. So working with a dietitian, and even, a medical provider as well, just to make sure that nothing else is wrong, is super key to making sure that you get to the results that you want. And I hope that in the last however many minutes that I've been talking, I've kind of convinced you of how complicated this actually is. And then we add on the fact that everybody's body is very different. So that adds another layer of complication. So definitely working with someone one-on-one is going to be the best way to figure out, okay, I'm symptomatic, what's going on. Obviously you can work with me. I would love to have you work with me. I'm booking availability on my website. But if it's not me, that's fine. Just find somebody who is a reputable professional who has a license and a clinical degree. So that's allergies versus intolerances. Don't waste your time and your money on the food intolerance test. It's just not worth it. There are a lot of somewhat popular elimination diets. So things like the Whole30, I'm trying to think, low Fodmap, even things like, the anti-inflammatory diet and stuff like that. There are the low FODMAP. Of the three of those, the low FODMAP is the only one that has any clinical efficacy. That said, you really want to work with a dietitian on that one because again, your response to it is going to be very different. So really, even if your doctor prescribes you like a low FODMAP diet or a low sucrose diet or a low lactose diet or anything like that, those things are meant to be done in stages. So it's meant to have an elimination phase where you eliminate whatever it is, but then there's also a structured reintroduction phase. So even if like we're curious about gluten sensitivity, right? So we want to definitely check for celiac. Celiac comes back negative. Okay, great. Next step is to, well, let's just eliminate gluten, because you can be allergic to gluten, which is celiac. But even if that's negative, you could still have symptoms because you're gluten sensitive, if that makes sense. So if you eliminate gluten from your diet and you feel better, great. But we want to kind of find out where that threshold is, right? You don't necessarily, that doesn't mean eat gluten-free for the rest of your life. And there's some indication that that may not even be a great idea. It's more of, we want to kind of figure out, okay, where is that threshold? Are there other foods involved, et cetera? And that's where working with a dietitian is really important. Low FODMAP is another one that a lot of times doctors will recommend that, which is very effective for treating things like IBS. But it does not mean that you follow that elimination stage or like a low FODMAP diet for the rest of your life. That's not the case at all. It's very restrictive and I would not recommend it to anyone. You want to do a full elimination for a period of time, but then you structurally in a structured way, reintroduce the foods that you eliminated to see which ones are problematic and which ones are not. That gives you the capacity, one, just to, sanely live your life and eat food and not be, tied down by restrictions, but it also is going to make sure you're getting a good number of nutrients and not avoiding foods that you don't necessarily have to. So, we always want people to eat as many different kinds of foods as they can. And there is a lot of evidence now that there is in fact harm if you're cutting out foods that you don't need to, such as gluten or dairy. And if you cut out gluten or dairy and that doesn't help, well, then gluten or dairy wasn't the problem, right? So stop cutting out gluten or dairy. It's not helping anything. But again, working with a dietitian or someone one-on-one is really the way to kind of tease apart those nuances. And then the kind of the last thing I want to talk about is supplements, because this is something else I get a lot of questions about. So generally speaking, again, this is based on good marketing from the supplement companies, but a lot of times people kind of get it in their head that they either need like a prebiotic or a probiotic or things like that on a regular basis. And First of all, to distinguish between prebiotics and probiotics. Prebiotics is basically a fiber supplement. It is nothing fancy. That said, probiotics are the actual bacteria. So as we mentioned, kind of, we've got all these bacteria growing in our GI system or in our colon. I think probably the best description I've ever heard of this is someone was referred to it as a farm. It really is. It's like a farm. There's like all kinds of different diverse crops in there. But if you know anything about farming or even just gardening in general, you need a couple of things for a successful garden, right? You need seeds, right? That's like number one, is that you need something to actually plant in the ground. But then you also have to tend to those seeds. You have to give them, water, light, sunshine, maybe a little bit of fertilizer, things like that, in order for them to grow well. So if you think about it in that context, your probiotic is going to be the seeds, and then your prebiotic is going to be like your water, sunlight, fertilizer, things like that. So a lot of supplements, obviously there's a benefit to having both. But what I will say is that more often than not, supplements that label themselves as a prebiotic or containing a prebiotic, almost always that prebiotic is a product called inulin. That is a type of fiber. It is not inherently good nor bad. That said, a lot of people who have GI intolerances don't tolerate inulin well. I have had patients who have had, years worth of IBS, they're taking this prebiotic, probiotic supplement, like nothing has worked for them. They've done various elimination diets, and like, it's the prebiotic that they're taking that is the problem. So be very, very mindful of that. If you don't have an intolerance to inulin, then it's kind of neither good nor bad. It's just there. In terms of whether or not you truly need a probiotic, to be perfectly honest with you, most people, the answer is no. When we think of kind of planting seeds in our little farm or a little garden here in our colon, your body at any given point in time is growing an order of trillions of bacteria. Any probiotic, regardless of like whether it's refrigerated, it's liquid, it's solid, it's a capsule, it's, got this many different billions of strains, blah, 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 whatever. Like all of that is going to be such a minor flash in the pan, that one, the probiotic supplements that are super expensive and you have to keep refrigerated are not any better than the other ones and than the capsules. What we worry about if you are going to do a probiotic is that we want it to get from your mouth to your colon. And to do that, as we've talked about, it has to go through your stomach and your small intestine, where it hits a lot of acid and a lot of enzyme activity that's basically trying to break it down. This is where probiotic foods can be really helpful. So things like yogurt, kefir, kombucha, kimchi, sauerkraut, all those kinds, anything that's fermented, is going to have some probiotic content to it. But also in terms of supplements that are available over the counter, honestly, Align is my favorite, just because they have the data to show that their product gets to your colon. That's not to say that other products don't, but they don't have data that proves it. so that's why Align is my personal favorite, and what I recommend to folks. That said, whether or not you actually need a probiotic, it's skeptical at best. Certainly if you have had like a very bad bout of like some type of gastrointestinal infection, if you've had very severe bouts of diarrhea, things like that, anything that could have kind of like obliterated your microbiome, because anytime you have diarrhea, you shed, well, really anytime you have any bowel movement, you shed some of your microbiome to an extent. Some of that's meant to happen as kind of like weeding, so to speak, if we're thinking about it as a garden. But if you have like really severe or really frequent diarrhea, you're going to be shedding more than you're regrowing. So sometimes probiotic can kind of just help to repopulate the seeds. That said, outside of that context, there's just not a ton of evidence that they're super helpful. I always tell people try it for 2 weeks and see if it helps. I'm not a big fan of the prebiotic probiotic combos. I'm much more a fan of getting fiber through your diet or through an alternative supplement, which I'll talk about in just a minute, and getting a probiotic that is just a probiotic. So whether that is like kefir, kombucha, yogurt, kimchi, anything like that, or like an oral probiotic supplement like the line, I recommend sticking to just a probiotic and leaving the prebiotic part of it off, just because so many people don't do well with that inulin. So a lot of times you're taking the probiotic to help with, the prebiotic to help with your GI system. And then unfortunately, it can actually make it worse. In terms of fiber that I do recommend, and I think this is a big misnomer, and this is kind of the last thing we'll talk about, in the GI world, there's a lot of confusion about fiber. So people generally think, and it's generally true, that like foods high in fiber are good for your digestive system. As I just said, fiber of all forms, whether it is inulin or not, is a fertilizer for your garden or your farm in your colon, right? So fiber is good for you. That said, the type of fiber, the frequency of fiber, and all of those kinds of things, you can be sensitive to fiber. So generally speaking, the recommendation for fiber is 15 grams of fiber per 1,000 calories. So if your goal is to eat 2,000 calories per day, then your goal is going to be about 30 grams of fiber per day, if that makes sense. And you can go back to my other videos to look at, kind of how many calories you should be eating in a day and all that good fun stuff. So that's just kind of the general goal. That said, everybody's tolerance for either the type of fiber or the amount of fiber can vary widely. So generally speaking, there's obviously all kinds of like fiber laden, snacks and things like that, or a lot of the keto type stuff is, like keto buns and tortillas and things like that. They're low net carb because they have a high fiber content. So that's one kind of common source of fiber, but also things like fruits, vegetables, whole grains, like those are going to be your main sources of fiber. But like I said, people's tolerance varies. A lot of times people can't tolerate too much of what's called insoluble fiber, and that tends to be most present in vegetables as well as fruits with skin, such as apples and pears. So sometimes that can be really harsh on your digestive system. So you may do better to either like peel or skin your apples or pears, or cook them down, or cooked vegetables may actually do better for you. What happens is that fiber gets kind of mechanically softened, so it's not as tough on your GI tract. If you have issues with kind of constipation, we just want to kind of increase fiber in general. But if you have issues with diarrhea, we want to reduce the amount of insoluble fiber you're eating and increase the amount of soluble fiber you're eating. Soluble fiber can be tough in food because almost every food source of soluble fiber that actually can like absorb water in your bowel and kind of make diarrhea less likely, also comes with insoluble fiber, which does the reverse. So a lot of times a fiber supplement, such as like something like Metamucil, Consul, anything that is like a psyllium husk fiber, is probably like top notch. But also things like Citracel and FiberCon are okay. They're kind of a blend. I'm not a big fan of Benefiber just because it's almost exclusively insoluble fiber, and it's not helpful for most folks. So like Metamucil, FiberCon, Citracel, those are kind of my like top three. Metamucil honestly kind of like far and away being number one. And like the store brands of any of those is perfectly fine too. So those are kind of some, if you have issues with diarrhea or loose bowels, honestly, as backwards as it sounds, a fiber supplement is probably going to help you a lot more often than a probiotic or a prebiotic ever will. So if you take nothing else away from this talk today, know that getting yourself a fiber supplement is probably like the thing that you need to do, at least as a first start. And then if it still persists, then by all means, consult your doctor. So outside of that, generally, 30 grams of fiber per day, which again falls in line with all of the other health recommendations that we make, right? Like, vegetables, fruits, whole grains, like those are all good for you. Not that that has to be all that you eat, but things like that are good for you. And they're also good for your digestive tract and kind of keeping your farm, so to speak, nice and fertilized. So that is all I had to kind of talk about. One thing that I didn't touch on, I guess we can talk about it very briefly, is just kind of this idea of like processed meats and colon cancer risks and things like that. Honestly, that could probably be like a whole talk in and of itself. And like, let me know in the comments if that's something you want to hear more about. There's just so much more nuance that goes into that doesn't really have anything to do with like the function of the digestive tract. So I'm happy to kind of speak more on that if that is something you guys want. Just let me know in the comments, because I know that especially if you have like a family member who's had colon cancer and things like that, it can be really kind of concerning to you of like what to eat, what not to eat. But I just feel like it strays a little bit from kind of the context of what we're talking about today. So that is it. That is all I have for you. And obviously, I'm coming out with some master classes. So I'm thinking about having gut health be one of them. As you can see, I can talk for a very long time about this. So, but we can kind of get into like some more specific recommendations and things like that, and include the piece about processed meats and things like that. So let me know if that is something you all are interested in. Otherwise, we still have the digital course for meal prep available. That is available on my website. I'll link it below. Obviously there's no live interaction with it, but it's still great if you have issues, planning or preparing your meals, or if you need to include more fruits, vegetables, and whole grains, but you're not sure how to do it. This course will definitely help kind of get you in the right direction of incorporating those foods more regularly. So that is all I have for today. I hope you all have a wonderful, wonderful rest of your afternoon or whatever time of day you are listening to this. And I hope to see you all again very soon.